And Dana, what is, if you could explain to people, what is the difference between the NCSS autism program and what school systems generally would offer?
Sure. School systems start with their supports with a paraeducator model. Some students don't even need a one-on-one, so it might be special education teachers that are providing the supports. And so they've gotten their education through, special ed programs, things like that, that might support people with autism. Our team, kind of what's different with that is we've got a little bit added components to our training, and that people really are getting ABA, Applied Behavior Analysis training, and some of us are in programs. I am a board certified behavior analyst as well, and we have some staff that are in programs to move towards that. And really what it is board certification in behavior analyst, so we're really able to support students in the most effective way and kind of through the theory base, if you will, to be able to support our programming in a data empirical evidence way. So we really help offer schools a little bit higher level of the behavior support. Most schools don't really have a BCBA that's working in that system. Since sometimes kids with behaviors, they need a little bit extra support with somebody that's got a little more knowledge in that behavior ABA world. So that's kind of what we can really offer on top of what schools have.
And Susan, how important is family support in achieving a positive outcome for a student?
Well, parents and other family members know their children the best. They are with them many more hours than we are, and I think that family support in the therapeutic intervention is actually very critical in a positive outcome. The student is part of a family system, therefore that family system needs to be able to be involved in order to achieve the best outcome.
And Dana, with autism diagnosis rates on the rise, what is the diagnosis rate and how is it impacting schools in our area?
Sure. Yeah, the diagnosis rate really, in a sad way, it's been increasing quite a bit in the last few years. They've seen, I think it's been a 20% increase within the last even year with diagnosis rates. Right now, we're at a 1 out of 88 children diagnosed or born today have autism. In the past, we had 1 out of 110, so that's really increased within the last year, that diagnosis rate. Schools used to have maybe 1 or 2 children coming through on an IEP or with autism, and now, one school said last year they had 24 children coming through in their kindergarten class, which that's a huge, dramatic increase. Sure. So schools really are trying to find a way to build their own internal capacities to support these kids because the numbers are just getting outrageous at this point. And then they're also kind of dovetailing on the wraparound piece. How do you wrap around that for homes to get supports and all those things? So we're really looking at all those components. So schools at this point, they want to build their capacity. That's something else that we offer as well, is help building their capacity to have maybe more supports for kids with autism. Some schools are building rooms that are specific with sensory integration techniques built in, and so we're really helping build those capacities in those schools. So they really are working hard to figure out, what are these needs coming in, the numbers are getting bigger, and how are we going to support that?